All right, let's hit on Guillain-Barre or Guillain-Barre. I've heard people say it all different ways, but to me, I think it's Guillain-Barre syndrome. What is Guillain-Barre? So basically, this is a group of, again, it's a neurological disorder, and it's characterized by progressive weakness, diminished and absent reflexes. It's again another rare thing. It's one of those things where it's the last thing that on your mind when somebody sees you. But again, if you're inpatient, that's where you're going to see it most likely because they came to the ER and already diagnosed. So it's so rare. Just to give you an idea, it's about 1 to 1.65 per 100,000 persons. And I know people get freaked out because the flu vaccine has a rare chance of having Guillain-Barre. So people hear horror stories about that and think everybody is, has that adverse reaction, but it's actually pretty rare. So you have more of a chance of dying from the flu than you do from Guillain-Barre. So that's what I do when I tell my patients when they're so afraid to get the flu shot. So it's weighing the risks and the benefits. Okay, so back to actual Guillain-Barre. What it does overall too is attacks the nerve tissue. So again, it can be triggered by immunizations, infections, or even surgery. You just don't know. Your body just decides to do it. There's sometimes we just don't know why it happens. So it's inflammatory and it demyelinates the nerves basically. So it's a progressive motor disease. Usually it starts in the legs and then it advances up to the point where sometimes you can't breathe and they need to be intubated. Some people just have mouth symptoms while some do progress and need to be intubated. And again, these end up being more of a permanent and not always permanent, but you have to go through therapy afterwards because if you lose your lose your ability to walk, then you need to learn to be able to walk again and get those muscles working again. So now this is one of those where it usually peaks at about 4 weeks. So it's not gradual over years. It's something that, your body's attacking itself due to something that you had. And now it's peaking in about 4 weeks. Then it starts resolving at that time. And then you start going through therapy. So one half of patients experience blood pressure instability, urinary retention. So just think about these patients too. If it's think about spinal cord injuries. Depending on where it's at, it's where it's going to affect that issue. So what they do is to diagnosis is they do lumbar puncture and nerve conduction studies. So if you do a lumbar puncture, it shows that you have increased protein levels, but your white blood cell count is normal. So you don't have an infection, but you have that increased protein level. And then you have nerve conduction studies. It shows slowing or possible blockage of conduction of the nerve. So these patients really should be hospitalized because you don't know how it's going to progress. You need to watch the patient very closely. And how do we treat these patients? Well, it's just trying to control the pain. You're giving them NSAIDs, anti-inflammatories, gabapentin. We're trying to work on the nerves and decreasing that nerve pain because these people are in pain also, and you're watching the respiratory. And remember, these people are going to be deconditioned too and definitely need rehab post treatment. And also sometimes they've done some plasma exchange therapy that has shown some good outcomes. But again, it's one of those rare things. There's studies out there. But again, there's not a whole lot of money put in Guillain-Barre. But anyway, so neurological problems persist at about 20% of patients with the disease. And one half of those patients are severely disabled. So it's not something that anybody wants to get because, again, it's unpredictable. You don't know how it's going to progress. And that's it. Okay.